More measles cases are showing up in different parts of the country and has now turned deadly in the Lone Star State. With the weekend and spring break ahead of us, East Texas travelers should be aware of how contagious the virus is. The latest CDC data shows 57 cases of measles in just 1 week. That's the highest weekly tally reported since the record outbreak in 2019. CBS's Jared Hill has the latest.
There's new concern over measles, an illness thought to be a problem of the past.
That's a disease they had way back, and now it's making its way around, and my fear is mostly the children.
One unvaccinated child has died from the Texas outbreak, the first U.S. measles death in a decade. As cases balloon past 100 there, more have popped up in other parts of the country. An adult in Kentucky, a baby in Washington State, and an infant arriving on a flight in Southern California. Each had recently traveled overseas. Same for the person in New Jersey who then spread measles to 2 others, all 3 of them unvaccinated.
This was declared eradicated from the continental United States. However, we do still see sporadic cases and travelers who bring it back.
The MMR vaccine, measles, mumps, and rubella, has been a game changer since being introduced in the 1960s. But according to CDC data, in 2023, measles vaccination rates for kindergartners were below 95%, the threshold for herd immunity. Doctors say vaccination is the key to stopping this highly contagious virus.
If you were to get infected, it would take 10 to 14 days for it to actually get sick. During that time, you could travel all over the place.
And spread it.
And spread it to an airport, to a store, feeling fine.
RFK Jr., the nation's new health secretary, said his department is watching, but called the outbreak, quote, not unusual. Jared Hill, CBS News, New York.
Governor Greg Abbott has spoken to U.S. Health and Human Services Secretary Robert F. Kennedy Jr. about the outbreak. Kennedy is offering Governor Abbott support in dealing with the outbreak, including technical assistance, laboratory support, vaccines, and therapeutic medication. But state health officials expect that number of measles cases to grow.